SteriClear's OxyFect Dentist Kit is an innovative disinfectant specifically developed in conjunction with South Africa's leading dentists, responding to the demanding requirements of dental clinics to maintain a world-leading standard in environmental hygiene. OxyFect offers a single product which disinfects your clinic, maintains your equipment, and also serves as a pre-procedural mouth spray. Dental procedures create an environment which is ideal for the transmission of bacteria and viruses. Distilled water is often used in the dental unit water lines, however, distilled water is not sterile water. Furthermore, using sterile water alone does not keep the equipment, handpieces, and water lines sterile, and over time, these units develop bioslimes, a breeding ground for bacteria and unwanted pathogens. Due to SteriClear's innovative technology, a little tablet goes a long way. No more storing of bulky chemicals or having to use many different expensive products to maintain the hygiene of your clinic. One tablet does it all. What's in the box? You'll notice the following items in your kit: 3 packs of OxyFect 8513 tablets, 1 OxyFect dispenser, 2 disinfectant spray bottles, which will be used to sanitize and disinfect surfaces such as countertops, dentist chairs, and common touch areas. 2 bottles, one for your dental unit water lines and one for your pre-procedural mouthwash, and 3 small oral spray bottles. How to use OxyFect in your dental clinic. First, you need to fill your dispenser up to the red arrow with water. Municipal tap water will do just fine. Then add 1 OxyFect tablet to the water and allow the tablet to dissolve within 30 to 60 seconds. This generates a dissolved gas in the water and turns a yellow-green, indicating that your dentist-grade disinfectant is now active. This solution is now the perfect formulation for disinfecting chairs, surfaces, and floors, as well as to be used as a cold sterilant to disinfect instruments, alginate impressions, and to disinfect your spittoon and suction lines weekly. The OxyFect gets to work by penetrating the cell walls of the bacteria and viruses, destroying them from the inside out and denaturing their proteins and DNA before they've had a chance to respond, meaning the bacteria or viruses cannot develop a resistance to OxyFect or release carcinogenic trihalomethanes. Furthermore, since it is a dissolved gas which does the disinfection, once it has finished taking care of the pathogens, it evaporates, leaving a zero residue disinfection. No harsh chemicals or residues to wipe away. To disinfect instruments, leave to soak in OxyFect for 5 minutes, then rinse with water. Alginate impressions, 2 minutes, then rinse with water. Spittoons and suction lines, flush for 2 minutes once a week, then rinse with water. Surfaces, fill the 1 litre spray bottles with OxyFect and spray on countertops, chairs, and high contact surfaces before and after each patient. Surfaces can be wiped down afterwards if desired, but we recommend to use separate disposable cloths for each surface to reduce the risk of cross-contamination of surfaces. The next bottle you'll notice is labelled dental water lines. Fill the bottle to the red line with OxyFect, then top it up to the 1000 milliliter line with water. This creates the correct concentration of OxyFect to be used to treat and maintain your water lines, scalers, and surgical handpieces. Next, empty the dental unit tank and pour the contents of the bottle into your water tank. This solution is now the only liquid to be added to your tank. No more untreated water or additional chemicals required. Use as per normal, and once the tank is empty, make a new solution and add to the water tank as your new standard process. Finally, we have the bottle which is labelled Pre-Procedural Mouth Spray. Fill up to the red line with OxyFect and then top up to the 1000 milliliter line with fresh water. This creates the correct concentration of OxyFect to be used as a pre-procedural mouth spray. Decant this solution into your smaller bottles and spray it into the patient's mouths prior to procedures to reduce the bacterial and viral load in the patient's mouth prior to procedures. This solution can also be used as a pre- and post-procedural mouth rinse when required. The technology inside each OxyFect tablet has been approved by the South African Dental Association, as well as being recommended by the World Health Organization for our battle against COVID-19. Rest assured, you are using the best. but even the best product in the world is ineffective if used incorrectly. Make sure to store your dispenser in a cool and dark place to ensure that the OxyFect does not expire prematurely. If the solution is green, then your disinfectant is active. Once it is clear, it is no longer active and a new tablet must be added. But if stored correctly, the OxyFect should last over 3 to 4 weeks, and the tablet last over 5 years if kept in the box supplied. SteriClear, the future of disinfection.